Today, gaming disorder, why it is stuck in diagnostic limbo, and what it would take to get out. A 16-year-old is brought in by his parents. He plays video games 6 to 8 hours every day after school, has nearly failed 2 grades, has lost his in-person friends, sleeps only 5 hours a night, and becomes aggressive when his parents try to limit his gaming time. His parents ask, is this a mental health diagnosis or just teenage behavior? Before you can answer that, you need to understand the strange diagnostic status of internet gaming disorder, and the answer is more complicated than you might expect. Will gaming disorder become an official DSM diagnosis? Here is the core problem. The World Health Organization included gaming disorder in ICD-11 in 2018. It is a fully recognized diagnosis, complete with diagnostic criteria under disorders due to addictive behaviors. The American Psychiatric Association took a very different approach. DSM-5, published in 2013, and the updated DSM-5-TR in 2022, placed internet gaming disorder in Section III, the appendix reserved for conditions requiring further study before consideration for full inclusion. So in the United States, gaming disorder is not an official diagnosis. It is a research category. The 9 criteria for internet gaming disorder, as listed in Section III, require 5 of 9 symptoms present for at least 12 months. They are preoccupation with internet games, withdrawal symptoms when unable to play, tolerance meaning the need for increasing time to achieve the same enjoyment, unsuccessful attempts to reduce play, loss of interest in activities other than gaming, continued use despite negative consequences, deception of others about gaming time, escape from negative moods via gaming, and finally, jeopardized academic, occupational, or relational functioning due to gaming. The threshold is deliberately high, 5 of 9 criteria, reflecting the APA's caution about overpathologizing normal gaming behavior. Why was the APA so cautious? One major reason is prevalence variability. Studies using different diagnostic instruments report wildly different rates, from as low as 0.2% to as high as 45%, depending on the criteria applied. Representative studies in children and adolescents suggest an average prevalence around 2%, but that figure masks enormous variation. Cultural differences in gaming patterns, the frequent co-occurrence with ADHD, depression, and anxiety, and the lack of validated standardized assessment instruments all contributed to the APA's decision to list internet gaming disorder as a condition for further study rather than a formal diagnosis. Whatever the diagnostic label, the clinical reality is significant. Internet gaming disorder frequently co-occurs with ADHD, major depression, social anxiety, and autism spectrum conditions. Studies consistently show that the majority of treatment-seeking individuals with gaming-related impairment meet criteria for at least one comorbid psychiatric condition. This creates a classic chicken and egg problem for diagnostic validity. Are we seeing gaming disorder as a distinct condition, or is it a manifestation of underlying ADHD or mood dysregulation? The answer matters enormously for treatment targeting. So what would it take for internet gaming disorder to move from Section III to a formal DSM diagnosis? The APA would need to see several things. First, consistent diagnostic thresholds across populations and cultures. Second, validated screening instruments with established cutoffs. Third, robust treatment evidence from randomized controlled trials showing measurable outcomes. Fourth, neurobiological correlates, imaging or biomarker data supporting a distinct disorder. Fifth, the ability to separate gaming disorder from comorbid ADHD or depression in a way that holds up clinically. And finally, field trials demonstrating reliable diagnosis by practicing clinicians. Current evidence is promising in several of these areas, but large-scale trials are still limited, and the neurobiological evidence, while growing, is not yet conclusive. Until gaming disorder is formally recognized in DSM, here is what you can do today. Use ICD-11 coding where available gaming disorder is recognized internationally, and your documentation should reflect that. Screen for comorbid ADHD, depression, and anxiety in any patient presenting with gaming-related concerns. Know that cognitive behavioral therapy, family-based interventions, and mindfulness approaches all have preliminary evidence supporting their use. And when gaming-related impairment is present, refer to appropriate specialists, even if you cannot assign a formal DSM code. The clinical reality does not wait for diagnostic classification to catch up. For questions or episode ideas, drop them below and subscribe for more psychopharmacology breakdowns. Educational purposes only, not a substitute for clinical judgment.